Hello, and thank you for joining us on TVC News at 1. Well, we begin this hour with health matters, as every 10th of October is the World Mental Health Day, a day set aside to raise awareness of mental health issues around the world and to mobilize effort in support of mental health. The World Health Organization says the day provides an opportunity for all stakeholders working on mental health issues to talk about their work and what more needs to be done to make mental health care a reality for people across the world. As the world commemorates this day, attention has shifted to the challenges people face all over the world, specifically Nigerians, and how the struggles get managed with feel-good phrases. According to Health Policy Studies 2021, a culture of denial is costing Nigeria dearly as untreated mental health issues drain up to 4% of the country's GDP, proving that a nation is only as strong as the mental wellness of its people. The World Health Organization says about 50 million persons in Nigeria live with mental illnesses, but fewer than 10% receive professional care, an alarming gap that has made this year's mental health advocacy even more urgent. And to discuss more on the World Mental Health Day, I'm joined by Medical Director of Mental Health, Dr. Adetutu Kunuji, joins me via Zoom to discuss this day. Good to have you join us at this time. Figures say about 50 million Nigerians are suffering from mental health illnesses. Talk to us about the Mental Health Day and how much you think Nigerians now fully understand the concept of mental health.
Thank you so much for having me. And today is a day I'm very happy about because we get to push the narrative that mental health is so important and there's no health without mental health. As you've rightly said, the issues are, they're right in front of us and the figures are alarming. 50,000 Nigerians in a population of 200 million living with mental health issues, and less than 10% of them having access to good mental health care. So these are the issues that we're struggling with: stigma in Nigeria. And, because of that, people don't want to seek help. They prefer to go through the unconventional methods of getting mental health care. And at the same time, the access to this care, because most of the specialists, in Nigeria, we have less than 300 psychiatrists, and less than 300 psychiatrists for a population of over 200 million people. That's about one psychiatrist to about 700,000 people. Really, really alarming. And so because of this, we keep talking about it. We keep bringing this to the forefront, trying to shift the narrative. In terms of affordability as well, that's an issue because majority of the people that even when they have access to the care, it's quite expensive because it's, under the private healthcare. However, the government is beginning to do quite a lot about it. They have already abolished the Lunacy Act that was there for many years, and the last administration signed the Mental Health Act in 2023. This makes a Nigerian have mental health as a right, and therefore you'd see that mental health is beginning to come into place even in workplaces. It's more recognized. It's not being stigmatized. You can talk about mental health struggles to your manager and they can get you the right help through employee assistance programs and things like that. However, there's still a lot of work to be done, and then this has to do with individuals, organizations coming together, having things to do or ways to talk about this and break the stigma. So one of the things that we do in Mente Calma, for instance, the theme for mental health, World Mental Health Day this year, is that we're looking at how we can get more access for people that have suffered catastrophes or emergencies. Right. And so this October.
Go ahead.
Yeah, and this October is a breast cancer awareness month, for instance. And so in Mental Calma, we're going to be thinking about what are the mental health, challenges that come with a life-changing diagnosis like breast cancer or many other things that people face, life-altering challenges that people face. And so these are some of the things that some organizations are doing, but individuals need to come out and talk more about these things. So, yeah.
And I agree with you that a lot more still needs to be done, especially access to healthcare in some rural communities, underdeveloped communities, is still a major concern, and also getting a diagnosis for something as critical as mental health. But from your own experience, what would you say are the leading causes or factors, especially for Nigerians, that cause an increase in the mental health cases that we are seeing? And how can we use, days like this to raise awareness on these risk factors?
So, for instance, genetics is a big issue. There's some illnesses that run in families. So schizophrenia, mood disorders, bipolar affective disorder, these are some of the things that, run in families. And so this is important that if you've got a family history, you need to take that seriously. Some of the things are like when women are pregnant, they're exposed to, a lot of stress, and this sometimes causes them to have mental health struggles. People do have such a thing as a postnatal psychosis, depression, anxiety. These are real issues that cause women not to thrive during the perinatal period. And so these are things that we need to think about. Some other issues would have to do with the imbibed culture that we have now of drug use. And so illicit substances, use of illicit, and this causes neuroadaptations and that continue to push on the addictions and also sometimes can lead to psychosis. Of course, there are some developmental issues that come into play when we're thinking about children, and so this can cause some mental health issues. And I'll talk about AI psychosis. I mean, everyone knows about the artificial intelligence. You all have that on your phone. What happens when your AI begins to feed into your delusions, the ones that you think, and you put it in and it gives it back to you exactly what you think, and it pushes those delusions. So those are things we need to be careful about in a nutshell. Of course, environment. There's stress, a lot of stress in Nigeria right now, financial stress and work stress as well.
That's a new concept. I'm just hearing AI, artificial intelligence psychosis. It's, a big one. But thank you for talking to us at this time. A medical director of Mental Calma, Dr. Adetutu Kunoji. Thank you for joining us at this time.
Thank you.